Hello and welcome to the Integrative Health Convention 2019 online interviews. Today we're going to find out more about a simple approach to nutrition with every patient consultation with Heather Richards, who's speaking at the Integrative Health Convention 2019 on the weekend of the 5th and 6th of October at the Park Plaza, Victoria in central London. Heather Richards is the College of Medicine lead for nutrition. She is a nutritional therapist, passionate about bringing nutrition education to all healthcare practitioners, enabling them to work in partnership to bring a lifestyle medicine approach and nutritional guidance to their patients. She is a co-founder and the director of nutrition of Sano, that brings healthy food to Londoners, which educates through an online nutrition school and teaches how to cook healthy food. Sano has online nutrition courses applicable to the general public wanting to improve their health outcomes, those wanting to develop careers in wellness, and also for medics and healthcare practitioners wanting to apply nutrition within their patient consultations. Hi, Heather. Thanks for coming.
Hi, thanks for having me.
Great. Heather, can we begin by letting the audience know a little bit more about yourself and what you do?
Yeah, sure. So I'm a nutritional therapist, and what does that mean? I see people in my clinic, and they come to me for a whole host of reasons, really. What I try and do is I look at patients' symptoms and I assess them as a whole. And I'm always trying to get back to what the root cause of their symptoms are, and then how I could help them address that through food. So, a consultation for me is really a good hour, which is, I know, is a luxury compared to what a medic would get, a really short amount of time. But I have that time to really explore their history, their case history, even right back to when they were born, because the difference, say, if you had a cesarean birth versus you were born by vaginal birth, is, your gut microbiome. Probably everybody's heard loads about that. So even going right back in somebody's history can really affect what symptoms they might be showing today. So it's about taking the whole jigsaw, looking at all their symptoms, looking at their case history, and then really determining or hopefully, really pinpointing what's the root cause of their problems, and then addressing that by coming up with, changes in their diet, sometimes supplements, but, diet is for me the foremost, because, we've all got to eat every day. Supplements are just really to support through difficult periods. And yeah, really looking at that whole person and helping them on their health journey. So that's kind of one bit of what I do. That's my clinic. The other things I do is, of course, through Sano that you mentioned earlier. We have an online nutrition school. So for me, I love seeing individual patients. It's great. But you can only help one person at a time. There's only so many people you can see in a day. And just wanting to be able to spread the word about nutrition and health and how we really can take control of our diets. Really, that's why I wanted to have these online courses, so that I can help individuals in that way, but also healthcare professionals. So helping healthcare professionals understand nutrition so that how they can help their patients, basically. And also training what we call nutrition coaches. So training people so they have real in-depth nutritional knowledge, so not stuff you read on Google, but they're not trained as deeply as I would be as a nutritional therapist, but they can guide people in healthy eating, so they could write recipes and meal plans, etc. So yeah, that's what I do, a whole host of things, really just trying to help people take control of their health.
Great, thank you. I'm always interested how people get to doing what they're doing now. So can you tell me the story behind how you got started, what you're doing now?
How I got started, yeah. I haven't always been in this field at all, actually. So it was really with bringing up a young family. I was previously in finance, but it was having young children and they started life with their own health problems, and really just seeing them develop and not being able to get to the root of some of the problems that they were left with. Just to explain a bit more, so for example, I had one daughter who was born at 27 weeks old, and one that was born with congenital heart disease. So going through that journey with them, we obviously had a lot of medical intervention, which was great. It was all very needed. But after we came out of that, we were left with other problems like eczemas and, things like this that, for years I battled with, going through, steroid creams, etc. And after about 7 years, I just thought there has to be a better way. And of course, through that exploratory pathway, just ended up really getting so involved and interested in nutrition. With the eczema, what we actually did in the end was we took out gluten out of the diet and did some Chinese herbs to smooth the skin. So that was really my journey. And then I thought, well, I want to help everybody else, because you go through your own journey, you want to share that experience with other people. And so decided to go and train as a nutritional therapist, and went from there, set up my clinic, and then again wanted to do more to help people. So that's when we set up Sano with the education courses, and also we've got healthy food on the high street with the Sano Cafe. So yeah, a journey through a family, really.
Oh, wonderful. I didn't know about your daughter. I'm sorry about
Yeah, you
that.
didn't
Is she
know?
all
Oh
right?
no,
Is she...
do you know what? They're all amazing, and it was a journey for us. It was a journey. It taught us a lot. And when we had Lucy, the third one with the congenital heart disease, in all honesty, I always try to look for a positive. I thought, well, the reason we went through the whole hospital thing with the second one, who was the 3 months premature, was by the time we got to Lucy, I understood everything about intensive care. It was like, so it wasn't a shock. So I knew exactly what everybody was talking about. So I sort of viewed that as my preparation. But yeah.
Wow. And in October at the Integrative Health Convention, you're going to talk to us about a simple approach to nutrition within every patient consultation. Can you tell us a little bit more about what this is about and what the audience will get out of it?
Yeah, exactly. So you probably sort of gathered now that I want to help people take control of their own health through what they eat, because, we all have to eat. Nobody's going to get away without eating, and we are what we eat. But unfortunately, in this age of, information, and we're completely overwhelmed by the amount of information, there's also so much misinformation. And I just want to help people dispel some of those myths. There are so many of them out there, but there's some really obvious ones, and just tackling those things about that. There are lots of people that try to lose weight. It's really hard for them. They can't understand what they're doing wrong, and then they flip from one diet to another, etc., etc. Actually, it doesn't have to be that difficult when you understand how the body deals with our food. And if you can get back to the basics, and you go back to the anatomy and physiology and what we do, it all actually starts to make sense. I want to explain some of that, and the carbs and fats as well, because the press is always full of it, isn't it? Carbs, fats, low fat, high fat, low carb, high, what should we be doing? And there isn't actually. It's not as difficult as you think. It can be quite straightforward when you sort of stand back, and the things like the snacking. Again, there's so much misinformation. You'll hear some people say, "Oh, I'm a diabetic. I need to eat 7 meals a day to keep my blood sugar balanced," and then somebody else will say something else. So I want to take everybody back to, really going back to how our bodies work, so that I can show you how it really does work and how we should be eating, because it is quite simple. And the reason why I think people fail in so many of their diets and think how many dietary models there are hundreds and hundreds and hundreds, because nobody's really kind of found the right thing, because I think everybody tries to make it very, very complicated. We are all unique, but there is a kind of base way of eating, if you like, that you can then tweak for your own personalization. But we don't need to be following a million diets and flipping between one or the other. And I'm also really aware that, you know, helping people and practitioners, so being able to help not only the general public in how to eat healthily, but also for other healthcare practitioners and medics, because, you know, we're the people that we're face to face with people all the time, particularly medics, but any healthcare practitioner. You're face to face with people with health problems all the time. Now, they tend to get to a nutritional therapist when sometimes it's the last resort, if you like. They've tried everything else. But actually, wouldn't it be great if every single healthcare practitioner you came across had a really good, solid base knowledge of nutrition, that they could advise those people so they don't have to get as bad as they are before they come and see a nutritional therapist? And I'm not saying everybody needs to have a deep level. It's about being able to give somebody a base level and then knowing where to signpost if necessary. So I just want to show people how you can do that even in a short consultation time, because we are really missing out if we can't guide all the people that come in to see us.
Absolutely. Thanks. So having thought about the Integrative Health Convention, where the audience will be made up of doctors, therapists, and the public, where do you see your particular practice fitting in with integrative health or holistic health?
Yeah. Well, as I said before, we all have to eat. So for me, you know, nutrition really is mainstream. It's food and nutrition. It's not a choice. It's not a choice as, you know, some of the other practices. You know, I might choose to go and see a homeopath or to do homeopathy. We all have to eat, and we are what we eat. And, you know, poor diet does cause more disease than alcohol, smoking, and physical inactivity combined. So we know it's really, really important. And we do collaboratively. We have this huge role to play, all of us together, so that everybody can start to take more control of their health. And we aren't getting to that point where people are ending up in chronic disease, because more people can guide in healthy eating and signpost. So I think nutrition is just core. It's core to every single healthcare practitioner being able to help in that way.
So I'm asking one last question, Heather.
Yeah.
As a nutritional therapist, and you've done it for quite a while now, what do you think in particular is the key to health and healing in what you do?
I think what makes the most difference, and where I will get patient compliance in anything I might be suggesting in healthy eating, is if we explain why somebody is doing something, or why it's needed, how the body works. Now, you might think, well, you know, it's too complicated. People don't need to understand that. They just need to be told to eat this because it's better for them. But actually, if you're going to take responsibility for your health, you're much more likely to do it if you understand why and how it affects you. So I always try to do that with patients, and I get much better patient compliance. And when we teach on our nutrition courses, we really do always want to see our students explaining why, because then that feeds through to when they start to use nutrition. It just makes such a big difference. You know yourself, if you're just told to do something, you know, that you're not really totally bought into it. So it's that understanding that I just think is so important.
Oh, thank you. So thank you all. Thanks a lot, Heather. And thank you everyone for taking the time to
Yeah,
watch and
thank
listen to
you.
this interview. Thank you. Remember to get
Very
your
much.
tickets early now from our website by following the links below. We are the Integrative Health Convention at the Park Plaza Victoria in London on the 5th and 6th of October 2019. You can use the discount code video5, which will give you a 5% discount as a gift from us to you for sharing your time with us. So when we see you in October in London, you get to meet Heather, myself, and all our over 30 speakers who will share so much more with you then. Great, thanks a lot, Heather.